Welcome everyone to the CGD event, where we ask, can a global initiative on health taxes finance development? My name is Pete Baker. I'm the Deputy Director of the Health Programme here at CGD. At the beginning of this month, with the sector in crisis, development experts and policymakers met at the historic 4th International Conference on Financing for Development. One positive outcome of this conference was an agreement that introducing or increasing taxes on tobacco and alcohol offer an excellent opportunity for countries to fund their own development. So I'm really excited today to be hosting this eminent panel of experts and policymakers to discuss health taxes. I will introduce them each one by one as they speak. But before we kick off with the panel, could I first invite Mr. Singh? We're really honoured to have you here as a former chairman of the 15th Finance Commission of India and member of the high-level task force on fiscal policies for health to give some introductory remarks about why this topic is so important to you. Over to you, Mr. Singh. Please could we unmute Mr. Singh?
Am I audible now?
Perfect, thank you.
Well, it's an honor and privilege for me to have been a part of this path-breaking task force and to see the positive recommendations which have emanated. And therefore, as a member of this task force, let me put my weight, intellectual and illustrative, behind the far-reaching recommendations which this task force has made. First, I have the broad following points to make. I think that first, the methodology which was undertaken by the task force was a robust one in being able to combine empirical research and findings with deeper and broader understanding of the theoretical outcome. The second general point is that there could not have been a more appropriate time than the time frame in which this task force was created, and the task force were able to give their very important recommendations, which spill over from mere mechanical or econometric type of conclusions into a moral dimension. And that's the third point which I want to make, that the important driving force behind this task force is the moral dimension, where there is now preponderance and overwhelming scientific evidence that the use of tobacco, alcohol, and highly sugared drink has far-reaching deleterious health consequences for the human society. So while Ministry of Finance officials, of which I was one, a number of years having served in the Ministry of Finance of the Government of India, as also my chairmanship of the Finance Commission of India, which basically devolves and looks into issues of the federal structure of the Indian government on how do federal entities behave during a period of this kind. So let me say that apart from the tax and the revenue consequences, which are certainly significant, is the human and the moral dimension, given the preponderance of scientific and other evidence to which I alluded to. And I think that in your very brief introductory, succinct remarks, you did mention that the recent United Nations conference concluding on the issues of financing and development has reached, rightly speaking, the conclusion that taxes on tobacco have really a positive outcome. And so from this point of view, the recommendations which have been made by the task force is a very robust one, that we do assume that given elasticity of demand, if the taxes on tobacco were to be raised very substantially, I think that the issues of people becoming increasingly more and more tobacco dependent would certainly ease off. So in my view, countries are well advised to look at the existing rate of tobacco taxation and to look for ways in which this can be substantially enhanced. Now, this is easier said than done. We know that the tobacco lobby and the entire tobacco web of advertisement and awareness campaign is a positive disincentive for policymakers to undertake what would be logical, both from a moral point of view and also from an economic point of view in terms of the assured garnering of revenues. So, this is the first big challenge which we have in the recommendations and in pursuit of the recommendations as a follow up of how to sustain a public opinion which can put enough pressure on the important political leaders and those who really handle the fiscal policies of government to enhance substantially the tax rates on the use of tobacco. On alcohol, too, I think that the it would be well advised to raise the taxation, both direct and indirect in some ways. Direct in terms of the companies who derive the bulk of the earnings and revenues from from produce and sale of alcohol, and indirect in terms of the consequences of it, what it means to the consumers of alcohol products in being able to pay much more significantly. On highly sugared drinks, this is a longer story. It is beginning to unravel itself, but from the data, I think that we need to focus more importantly, with much higher priority being given on taxes in multiple ways on both tobacco and in terms of alcohol. Now, looking at the Indian data, whereas taxes on tobacco have gone up, I dare to say that there is still considerable room for the tax authorities, namely the Ministry of Finance of the Government of India, of which, as I mentioned to you, I was an integral part for many years, to substantially increase the taxes on tobacco. This would be an active deterrence to more and more people in having tobacco consumption, and certainly to make lower the consumption per capita in a certain sense, but in each individual, even those addicted to tobacco, to discourage them from a further increase in consumption. Now, I think that this is true for India, equally in terms of the on alcohol, which is a state subject. I would dare to suggest that in India, not only the central government, but the different integral entities of the federal structure of India, the states could be an important player in both enhancing and encouraging the central authorities. I think both the central government and the state government needs to act in partnership. India is one of the few countries which has enacted a fairly robust legislation in regard to the third tier of government, one at the central government, one at the level of the different federal states, which all have a federal autonomy in terms of the constitution. They have their own parliament, what is called the state legislative assembly. And then, of course, with the constitutional amendment, we have devolved considerable powers to the third tier, which is the urban municipal bodies, municipalities, and below that, the panchayat structure. So I think that all the three levels of governance in India need to act in tandem to look at this issue in a holistic way, to draw the robust findings of this task force and coming to the conclusion that the tax, both direct and indirect, in many, many innovative ways on tobacco, on alcohol, and sugary drinks can see an upward direction. So I will fully, as a member of the task force, put my weight on the special findings and the findings of the experts on the use of fiscal instrument creatively, innovatively, and imaginatively to substantially increase both the revenue, which is good for the any treasury, whether it be for the central treasury or the state treasury, or for the finances of the urban local bodies, municipalities, and the panchayats, to do so in a manner which will have the happy moral outcome of people reducing the consumption of these three very harmful products, particularly tobacco and alcohol. So I was privileged to be part of this task force and to put my weight behind the recommendations which the task force has come to. I realize it is a very rich panel which exists, but I wanted to have this opportunity to share my thoughts with you of having worked as a member of this very, very illustrious task force on an issue which has both an economic and a moral dimension. Thank you very much for allowing me this opportunity to share some of my thoughts with you.
Thank you so much, Mr. Singh. That's a very strong, clear message of the economic and the moral case for these taxes. And that now we're entering into the political domain of how we take that forward, tackling the industry interests and bringing different parts of the Indian government together, and indeed other governments together, to tackle this difficult issue. I'm aware that you have to go now to your next meeting, so thank you for your time. We are honoured.
Thank you very much. I wish this panel discussion every success. I'm sure that as a moderator, they are in safe hands, and you would come to the very, very happy conclusion that the recommendations of this task force deserves the fullest support and encouragement of what will emanate from today's what would be an enlightening panel discussion. Thank you very much for this opportunity.
Thank you, Mr. Singh. So here at the Centre for Global Development, we were honoured to be the secretariat for the task force and assisting Mr. Singh and colleagues as they deliberated on the scientific evidence that he talked about. And so on behalf of Mr. Singh and on behalf of the members and co-chairs, please could I now invite Catherine Klemperer, a research associate at CGD, to present those key recommendations and key findings that Mr. Singh just mentioned. Over to you, Catherine. Catherine, I think you need to unmute yourself, I'm afraid.
Sorry about that. Thanks, Pete. So I'll just quickly walk you through some of the findings of this task force report, of which NK Singh is a member. So just to give you a little context, the task force was initially convened in 2018 and put out a report in 2019. Then we went through a pandemic and global fiscal crises, and so attention was understandably distracted. So the task force was reconvened in 2024 to examine progress and regain the initiative. And this reconvening happened in a time contextualized by both health and fiscal crises. So on the health side, we're in a time of rising non-communicable diseases fueled by tobacco, alcohol, and sugary beverage usage. Indeed, by 2030, non-communicable diseases will account for 75% of all deaths globally. And then on the fiscal side, we have this pandemic, which pushed governments into emergency spending, leading to unsustainable debt burdens, and so constrained fiscal space. And indeed, we now have 3.3 billion people living in countries that spend more on debt repayments than they do on health or on education. And further to this year, we've seen steep cuts to international aid budgets. So official development assistance is dropping by around 15%. And this all combines to mean that domestic resource mobilization will be ever more key. And the task force found that health taxes are a quick and efficient revenue source. If we were to raise health taxes enough to generate a 50% increase in the prices of these products, we could raise $3.7 trillion in just 5 years. If this was allocated to health, it's the equivalent to increasing the global budgets of government health budgets by 12%, and in low and middle income countries by 40%. And so many countries have shown that such success is possible. This example showed the impact of increasing alcohol taxes in Lithuania, and we'll shortly hear from Mule Weldu and JP Jr., who were involved in successful increases in Ethiopia and in the Philippines. And of course, it's not just revenue that health taxes can create, but health taxes also save lives. So raising taxes on all three products to increase prices by 50% would lower consumption enough to avoid 50 million premature deaths over 50 years. And tobacco taxes will have the greatest impact on lives saved, with such an increase meaning over 100 million people, which is equivalent to 10% of the world's smokers, would quit smoking. And the majority of these people live in low and middle income countries. Perhaps due to the fact that they have these both health and fiscal benefits, health taxes aren't a partisan issue, and governments that have raised health taxes span the ideological spectrum. We also see substantial support for health taxes from the public and even from consumers of the products themselves. And this support is especially high if the revenue is earmarked to popular programs such as health or education. But despite this, progress on health taxes has stalled in the past 5 years since the previous task force report. We've seen only a handful of countries raising cigarette taxes meaningfully, and so 87% of people live in countries where cigarettes are equally or more affordable than they were in 2016. We're also seeing a decreasing number of countries reporting using alcohol taxes, and while many countries have recently implemented sugary beverage taxes, the rates are very low. The task force report demonstrated how health taxes are one of the most effective policies we have in the toolkit. To use them to their full potential, the task force made 6 recommendations for countries. Firstly, they should significantly raise health taxes and prioritizing tobacco taxes as they have the greatest impact on lives saved. As well as increasing them, it's important to consider the design of these taxes. So they need to be regularly raised above the level of inflation to ensure that products actually become less affordable over time. To pass these taxes, it will be important to counter industry opposition through framing the debate according to motivating contextual factors, mobilizing public support using evidence from NGOs and academic partners, and enacting policies to limit industry influence. It's also important to ensure policy coherence. So, for example, reducing subsidies for harmful products and limiting the ability to advertise them. And then it will be important to use the technical resources available from institutions like the IMF, the World Bank, the WHO, regional development banks, etc. And for their part, multilaterals should proactively promote effective health tax increase whenever they engage with countries in fiscal policy dialogues. And this fits very nicely with a new initiative, which JP will speak about in just a moment. Thank you very much.
Thanks, Catherine. Excellent summary and a very powerful report. I do encourage people to take a look at it. Now, we're really here today from the prompting of the WHO, who have got some good news that they are launching a new initiative, a new global initiative on health taxes. And Jeremiah Paul Jr. is the unit head of the fiscal policies for health at WHO and is responsible for this excellent idea. And so over to you, JP, to give your thoughts on this initiative. Please unmute, and I'd be grateful if the technical team could raise the slides.
Yeah, thank you very much. Can we have the slides, please?
There we go.
So I'm going to talk about the 3x35 initiative, which was launched during the Financing for Development conference in Seville, under one of the initiatives under the Sevilla Platform for Action. So what is the 3x35 initiative? It is really a call on countries to increase the real prices of any or all of the 3 unhealthy products, tobacco, alcohol, and sugar drinks, by at least 50% by 2035 through tax increases while taking into account each country's unique context. One of the things that really came out during our consultations that each country is unique, and therefore one has to consider the initial conditions. And one of the things that we're really doing there, this is really a tailored approach to helping countries increase taxes. The 3x35 initiative expects to mobilize an additional $1 trillion in public revenues globally over the next decade. And this is really a partnership. It's coordinated by WHO, but to date, we have the UNDP, the World Bank, the OECD, the Alliance for Health Systems and Research. We have Vital Strategies, Center for Global Development, Campaign for Tobacco-Free Kids, Economics for Health of the Johns Hopkins University, the Southeast Asia Tobacco Control Alliance, Bloomberg Philanthropies, NCD Alliance, Movendo International. And we've been getting more and more inquiries and more interest. And the latest one was the Tax Justice Network for Africa, that they wanted to join the initiative. So again, I'd like to stress that this is not just WHO, this is really WHO together with its partners, because we need a coalition for reform. Next slide, please. So what are the three strategic actions that are going to be done under this initiative? First is to engage member states through high-level advocacy, technical support, and peer learning. In our experience, peer-to-peer learning is really an effective way by which member states can learn from each other. Multilaterals and the academic institutions can provide technical support, and civil society and other entities can provide high-level advocacy support. The other thing that I'd like to stress, that this is really a country-led reform. This is something that is with tailored guidance, with tools, and evidence sharing. For example, in WHO, we already have tools, technical manuals on tobacco, alcohol, and SSPs. The World Bank has similar tools. The OECD has similar tools. So all of us work together and making sure that we are on the same page and advising countries similarly. And we're coordinated in that we don't give conflicting advice. The other third pillar is really to strengthen political commitment through partnerships, communication, capacity building, and recognizing success. One of the key challenges that we find on the ground is that the strong lobbies, the strong vested interests that really are against raising of health taxes. When you're talking about communicable diseases like malaria, for example, mosquitoes don't have lobbyists. But when we're talking about health taxes reform, you really have strong lobbyists who really are against reform. So we really need a coalition of reform, political will at the highest levels. Next slide, please. So be smart, because health taxes saves lives, mobilizes resources, address health inequities, reduces future health systems burdens, and target NCD risk factors. Join the 3x35 initiative, implement health tax reform, because after all, health is wealth. A healthier population is a wealthier population. For inquiries or interest, please email healthtaxesunit@who.int, and we will be prepared to respond. Thank you very much for listening.
Wonderful. Thanks, JP. I think you're exactly right that because this is both a health issue and a fiscal policy issue, it's always going to need both a kind of finance perspective and a health perspective, but always need a coalition of actors working together on it because of that. It's not in the power of any one group. And because it's so political, it will also need a coalition with civil society to make this work. And that your kind of country-led peer-to-peer approach looks exactly the kind of thing that's needed. So it's very exciting. Okay, over to Mule. Mule Weldu is the head of the tax policy department at the Ministry of Finance, Ethiopia. And Ethiopia have had some success recently in introducing these taxes. And we're delighted to have him here to share it with us. Over to you, Mule. Mule, you'll need to unmute again because we're having these technical problems. Mule, please, I don't know if you...
Hello?
Yes.
Hello?
Thank you. We hear you well. Please go.
Okay, thank you very much. All of you, I will be very brief. I will not go on the details. You have introduced me, and let me just continue with the... Can I scroll it?
Mule, please, yes, please go ahead. Not sure we've got the right thing on the CG reference page.
Okay. Let me stop. Okay. Okay.
There we go.
I think now you can see, yes?
Yes.
Okay, please. So can we move to the next step, the next slide? Yes, this is outline, but let's move to the next slide, please. So this one is like in Ethiopia, the health financing and in Africa also, as it has been also presented by the previous presenter from India, health financing is critically important because of many reasons, among which are poor domestic resource mobilization that is hindering us to allocate the necessary amount of resource for health. And the other thing is the development partners finance, which is drying out. So this is making the universal health coverage to attain and this sustainable development goals also. So this is a very critical time. So can we move to the next slide? So this is just general one. It's because we are as Ethiopia, we are part of Africa, and this is just to show this is well recognized at the continental level. This is critical because new health problems are rising. You can see, and the finance, especially as I have mentioned, is declining like by nearly 30% so far. So that's that needs us to look for another sustainable approach to finance health. So can we move to the next slide, please? This is also the same. I was participating in discussion last time. It was done in Ethiopia, and this is the same thing, which shows the health funding is becoming critically important, especially for Africa, because of the finance problem that I have been mentioning. So can we move to the next? Yeah, this is important and related to our discussion today. As I have said, in Ethiopia, what we do is we don't allocate tax specifically to a specific sector. We actually use consolidated approach. So our effort is always increasing the pie in general. Then we allocate good portion of the tax revenue that we collect. We don't follow like what they do in Philippines, for instance. We have visited very recently, because they are in Philippines, they allocate the tax from this sin taxes to the health. In our case, it's a bit different because we use a consolidated approach. But what's critically important is our tax to GDP is very low, about 6%, 6.3%. And this is also creating pressure for us to allocate sufficient amount of revenue to the health sector, as it is already low. But if you see the graph on the right side, it shows that much of our resource is coming from domestic level. It's about 5% of the total budget that we receive from external sources. Can we move to the next? This one is like the first graph shows the share from out of the total expenditure. We allocate 10% for health, and this is the next largest share from total expenditure next to education. About 50% of our total expenditure goes for these proper sectors like agriculture, health, water, road, and so on. And out of this, 10% is for the health sector. So you can see our allocation is, even though there is no specific tax allocated for tax revenue allocated for the health, in general, we try to allocate sufficient amount of money or finance for the health sector, even though the resource already is very low, as I have tried to mention earlier. The second graph shows the per capita expenditure of health, which is very low actually, even though it has been growing from very low level. It's now about, I think, 38, if you can see. But if we compare to Philippines, we are very far, even to reach half of that. So that shows we need to move a lot, especially from per capita perspective. And this may, demand some policy actions, which I am going to come back later on. So next. This one is critically important because this shows the share of the finance that is being allocated for the health. So about 33.9%, as you can see, is received from donors. And as you have seen recently, this is becoming very unsustainable. So we need to fill the gap. So this is just to show the out-of-pocket government share. And the last one is the 10% government general expenditure that I have mentioned. But what's critically important is the donor part, which is in challenge at this time. Next, please. This one is related to the reform that we have done very recently, in 2020 actually, and the WHO was important in supporting us. Our excise tax has been declining from year to year. As you can see in the third graph, it was for the first time after the reform that we have observed about 25% growth in tax revenue as per the target. But the total in general has increased by 55% tax revenue from this excise. So the reform was critically important. And it was done implemented during the COVID time. The time was not a good time, but we were able to increase our tax revenue by this amount. As you can see, we have also changed, the tax base, the tax system is also critically important. It was cost of production based, so we moved to X factory or factory gate price. That was also critically important because these tobacco and alcohol producers were becoming, almost zero from excise tax because of the legal issue also. So we tried to improve that, and our tax has increased from this. We can move to the next slide. This one is generally to show the revenue share. As you may have the information about Ethiopia. We don't have much. On the tobacco part, as compared to other countries, the prevalence is very low, and the revenue also is low. Of course, there is also illicit trade problem, but much of the revenue is coming from beer, from the beer industry, which is 43%. The tobacco industry contributes only about 7%. So this will show us where we need to focus. Next, please. I think this one is critically important. I have observed this one recently. So one NGO, we have income generating activities low. It allows for the NGOs or civil societies to engage in business activities. So you can see this one, the blue one, they cover from their their own businesses. So this can be one way of making our financing more sustainable. Next, please. So let me focus on this one. The challenges we faced during our reform was the industries were trying to employ very known consultants, continentally well known, and they were trying to challenge us not to increase the tax rate, not to change even the base. And they were even pretending that they will close their businesses and there will be layoff of employments and so on. And it was critically difficult time. So the mechanism that we followed to avoid this, we were well informed ahead of them. We were with data were collected, and always at every step they come up with the challenge, new studies. We also present our own study. We worked with the with the WHO, especially if you tell the people this is recommended by the WHO or others, they will not accept you, because you need to first tell them this is owned by our own, it's our initiative, but this is also supported by the WHO. So it was critical approach, and the NGOs, this cancer societies, and so we are very critical and helpful. The Ministry of Health in the Parliament were also critically important. So this one, this mitigation approach has helped us to enforce the new law, which has brought a lot of changes. The last one, please. The last one is like, we are also planning this year, we will have amendment to the law. So there could be an increase in the rates for tobacco and alcohol products. We are also implementing this track and trace system, which is going to be important to enforce whatever we try to increase the revenue. So at the last, you can see we are also working with the Ministry of Health to devise a strategy to increase the health financing. Maybe we can also direct some of the health taxes directly to the financing of the health. So we are underworking on that. We will see finally what will happen. But there is already an interest, a commitment, political commitment to increase the finance for health, given the declining donors' finance and even the finance, general finance resource mobilization in our country. Thank you very much, Beth. Sorry for taking time.
No, that's great, Millie. Thank you so much, because I think what you've done there so well is to show how this is part of development financing for your country, health financing for your country, and in fact for the whole African continent. And actually that you were able to raise your excise revenues by 55%, particularly by focusing on beer, how you were able to take on the tactics of industry. And I think that was it's got a lot of valuable lessons for other countries to learn from. So thank you so much for your time.
Thank you, Pete.
Next, can I invite Marianne Etibet, President and CEO of Vital Strategies, and also we're honoured to have you as a board member at CGD as well. So I guess what would be particularly good to hear from you is your work on looking at country-specific evidence and tools that can be used to generate that evidence so that country policymakers can make the case of this being good for the budget for their countries. So over to you.
Thank you so much for the question, Pete, and for the invitation to participate in this panel. I think you're exactly right. Being able to not just have country-specific data, but country-specific support is critical if we are to ensure that countries around the world are going to be benefiting from the triple win that health taxes create. Catherine spoke to not just the amount of domestic revenue that it can generate, but the reduction in health costs and health burdens for so many countries that are not even able to address current health needs. And then, of course, how it saves lives by reducing risk factors for the top killers, non-communicable diseases like diabetes, heart disease, lung disease, and cancer. I'd like to also frame your question around, what I think are some of the 4 C's of things that are creating what I would call an opportunity for us as a community to seize. We mentioned that there's been a collapse in global health financing. And my question would be, well, why isn't everyone clamoring to do health taxes? It would seem like, the slam dunk solution for helping countries address the gap that they have to support health budgets that's been lost from whether it's USG, United States government financing, or other bilateral or multilateral financing. Why wouldn't we do health taxes? And so number one, as you mentioned, is that lack of country-specific information. And one of the things, and thank you, Mr. Weldu, for emphasizing, that that's something that country governments and their people are asking for. So one of the things that Vital Strategies has done in collaboration with our partners from the Johns Hopkins University, as well as American Cancer Society, is build an interactive data modeling tool called CORE, which stands for Cost Recovery and Revenue Estimator. And what that does is it's designed to help, and it's a public tool, and we can share, how to access it later. It's designed for the public health community, advocates, and policymakers to estimate both the health and economic gains that are possible from raising tax on tobacco products. And I'll give you an example. If you go in and, put Kenya in, for example, you can see by just raising the tax of a pack of cigarettes to grow the price from about 400 Kenyan shillings to 700 Kenyan shillings per pack, Kenya could raise an additional 58 billion shillings, which is equivalent to almost 500 billion US dollars a year in revenue. And this would actually help fill the gap for 78% of the losses of the recent cuts in overseas development assistance. So again, slam dunk, why aren't we doing this? And I think the part of the reason where it's not top of mind or hasn't been top of mind, I think that that's changing, is lack of communication and coordination and awareness, of this as a tool across sectors. Ministry of Health talking to Ministry of Finance. How do we link what's happening in the technical units, of ministries with the politicians and the policy advisors? How do we share information across countries, that this can work and has been shown to work and give results? And so that's why I was so excited, that Jeremiah Paul talked about the WHO 3x35 initiative, because one of the key goals there is to break down those silos, raise awareness of this, fit for purpose solution, and make sure that we can support countries in accelerating their efforts to implement, health taxes. That also addresses that third C, complexity. I think when you talk to a lot of folks, they may balk at the thicket of complexity that is health taxes. But one of the things I want the audience to understand is that not only do we know what to do, and we know it works, we know how to do it. And there are best practices, tools, and resources that exist across the globe and all the different continents. And those best practices and experiences can be shared, through things like the 3x35 initiative and other platforms, including the Task Force on Fiscal Policy for Health, to share that information. And I'll share, another piece around that. You may be surprised to realize that actually on the African continent, 37 of 48 countries have some sort of taxes for beer, alcohol in place. But the range of that tax ranges from 1% to 40%. So there is real opportunity to optimize existing taxes. For tobacco, there's only 2 countries that don't have some sort of tobacco tax in place. But again, the rate of that tax ranges from 5% to 62% in Mauritius. Again, how can we learn from countries that are really optimizing health taxes to get that triple win, to get that public health benefit, which is so critical? For sugar, 31 of 48 African countries have some sort of tax, but that ranges from 0.4% to 20% in Rwanda. So, sharing all of this to also address that fourth C, which I like to call confounding, which is all of the misinformation and disinformation from the industry to prevent these health taxes from becoming policy and becoming law. Part of that misinformation and disinformation is fueled by, $85 billion worth of aggressive advertising as they look for new markets, new consumers with new products. But I'm really heartened by you bringing all of us here together because we know how to do it. We can share that information across countries, and we know it works.
Fantastic. Thanks, Mary. I love the 4 Cs. Something I need to think more about. Okay, we only have 10 minutes left of this webinar, so I wonder if we should get straight into the hard issue really here. I think we've all heard this is a topic which now has clear economic evidence behind it, has clear health evidence behind it, has a clear ethical imperative, as Mr. Singh called it. It's a slam dunk policy, I think, as you called it, Marianne. That malaria don't have lobbyists, as you said, JP. In the end, this is a lot about industry pressure, and I think we have to address that difficult topic for a second. So I think you've all talked a bit about it, but I'd love to hear some more reflections on that. Perhaps, JP, we could start with you. What do we do about this as a public health community? How do we tackle a topic that has at its core attention with industrial lobbyists? Over to you.
No, I think this is a given, and I would call them the scare tactics of the industry. For example, the tobacco industry, that if you increase tobacco taxes, there would be increased smuggling, there will be court and legal challenges, it's anti-poor, revenues will go down, or there's a negative employment impact. But if you do your homework, you have political will at the highest levels. If you do coalition building in WHO, we essentially, one of the things we do is, apart from providing evidence to help countries address these issues, is that we work with them and really look at it from their perspective. So you need a whole of government approach for this, and communication, strategic communication, to address the doing your homework well.
Thanks, JP. Do your homework, coalition building, be well informed. Mule, how did you take this on? You had that last slide which did a bit of this, but I think I'd like to give you time, Mule, if you can hear us. On the right-hand side, you started talking about some of those strategies that you dealt with the industry influence. Maybe could you say a bit more about that? How did Ethiopia handle the pressure from industry? I can't hear you. Sorry. Remember, Mule, you have to unmute before you speak. Thank you.
Yes, sorry, Pete. So as JP said, what's critically important is, coordination of institutions, government institutions, especially Ministry of Finance and Ministry of Health. And what's critical also is that, especially at the final stage, we have this NGOs, or I don't know what to call them, like we do have this Cancer Society and so on. And so they are very helpful. Unless and otherwise, the law will not be successful. So they were critically important, and we were with them, and they were very supportive. The other thing is, you need to be also, as a government, you need to have all the information. You need to be very, equipped with data. You need to be very objective. So whatever data they come up, whatever studies they come up, you need to present your own data from different sources. So that was critically important for us. I remember that I had 7 times discussion with the beer industry. So 7 times they come up with every time different rates. Our rate is about 40%, for instance. They came up with 3%. So we started with 3%, we fixed it at 40, and we eventually ended up with 40. And that was, being informed better than what they are. They know they know that you are informed, but they think maybe you may not have that information. So they come up with KPMG, Deloitte, and so on and so on. So be more informed, have the data at hand, and convince policymakers also, and some of the time, for instance, the tobacco industry, they bring to you like there is illicit trade, for instance. To some extent, we believe that is true, but we need to come up with track and trace system for that. So whatever reason, whatever gaps they mention, you need to come up with the solution. So you shouldn't leave any room for them. So I think that was critically important. Political commitment, being, collaborated with different institutions, being more informed and have objective data. That was critically important for us. I think from what I heard from Dr. Marie, I think our rates are higher than many of the countries that you have mentioned because we were successful at that time. And that approach was great, I think. Thank you.
No. Thank you so much. And, we'll have to make sure that other countries can learn from your experience. And, Pete, to your question, I do think there is a wealth of evidence that can debunk the myths that industry puts out, and evidence from, on a regional and country level that show that these policies are generally employment neutral, that there can be measures put in place to eliminate the illicit trade, especially when supported with effective enforcement. And I think the most critical piece is that the public is behind you. Mm-hmm. And so if you do this in dialogue with the public, and there are opinion polls, whether it's across Tanzania, Sri Lanka, Colombia, Guatemala, it's over 74% of the public are in favor of health taxes. 74%. Like what other political policy agenda gets you more than 74% of public support? And so any efforts on health taxes need to engage the public and civil society and get them on board. And it needs to be done in an intentional way, with campaigns, with polling, with strategic communications, because at the end of the day, we're talking about new norms and new normals and lived experiences being created for folks. And I think the public can imagine a world, where their children, are not being bombarded by aggressive marketing for, flavored cigarettes, or, reduction in domestic violence from alcohol. And so when you do have this dialogue with the public, I think that counteracts a lot and debunks a lot of the myths you're getting from industry.
Well, thank you so much to all the panelists. This has been a fascinating session. Thank you, Muley. Thank you, JP. Thank you, Marianne. I think we've heard a compelling case for this policy. And I think we've also heard that we don't have to accept it. We don't have to accept the incoming wave of non-communicable diseases. We don't have to accept rising affordability and rising consumption of some of these commodities. We can, through coalition building at the national and global level, through data, through well-informed policymakers and civil society, through use of the public support, through good systems to track the taxes so we can make the case that they aren't causing the harms and debunk some of those myths, we can actually implement these, raise money for health systems, raise money for development, and promote better health. So I'm excited. There's a good opportunity in global health to take this forward. And I want to thank everyone for listening and for joining us, and for all the panelists for contributing. Thank you.